Good morning, everybody. We're just going to wait a few more minutes to make sure we give everybody time to get in and get registered. Okay, we're going to go ahead and get started. My name is Kelly McPherson, and I run the daily operations here for the Washington State EHR program. And we have on with us Kim Jacobs and Holly Givens, who I'm sure a lot of you have probably spoken to. They're going to be responding to your questions. If you have a question anytime during the webinar, go ahead and click the questions option in the webinar toolbar, type in your question, and click send. If it's a question that they can't answer right away, they'll be responding to you as soon as possible. Let's see here. So we're going to go ahead and get started. A lot of you should already be familiar with the EHR application itself. This is for Meaningful Use Stage 2, or Stage 1. Come on here. So you've already attested then to AIU. So you should already know how to log on. You've already been to CMS for AIU, and you've already registered. So at this point, when you're coming back in for Meaningful Use Stage 1, could be Year 1 or Year 2, you should have received an email notification via the application, and it should tell you it's time to go ahead and come on in, and you can go ahead and register for Meaningful Use. And let me go ahead and show you. Let me go ahead and bring up a copy of that email that you should be receiving. This is what the email looks like. She'll be getting this, and the person that receives this is the contact person that's listed in eMIPP. So when you registered at CMS, whoever you registered as the contact email, that's who's going to receive this email that you're looking at right now. So if you're not getting this and you're not sure if it's time to come back in, you might want to go back to CMS and see who the contact person is, who you have listed there. A lot of times we have staff turnover within your office, so it might be an old contact within CMS. Okay. So this is the Provider One login screen. You should already have your domain, your username, and your password. If you don't have If you don't remember your username or your password, you can ask your system administrator, or you can contact our security department. This is our health IT website, and on here is all of the information we've updated as of recently. The whole website's been reconstructed. We're going to have instructions and worksheets, white papers. We're going to go through these, communications, who to contact. So now we're going to open up what is our user guide, and this will have information in there who you would contact for security to get your domain, your password, and your user ID. So this is instructions and worksheets. We have this separated out for eligible hospitals, eligible providers, specialists, and dentists. On this screen here, you can click on the EP, Meaningful Use, eMIPP User Guide. This is for the meaningful use, which is what you would be attesting to for year 2 and year 3 of the program. So we're going to actually go into the test environment, and we're going to navigate through. We're going to show you guys the navigation. This user guide will give you screenshots if you need to refer back to it, and it'll walk you through the domain, the username, the password, selecting your profile, etc. But at the bottom of this user, we're going to go all through that today, but at the bottom of the user guide gives you a glossary on what type of documentation is needed that we're going to be requesting, terms for charity care, FQHC, RHC, needy patient volume, your no-cost encounters. I highly suggest that you go and you open up this user guide and you go through it prior to attesting. And then at the bottom, under helpful hints, again, just more navigation, but it also has contact information, your CMS, EHR contact, and security contact. So if you need to go back to CMS and update your contact information and you're not sure how, these are the numbers you're going to want to call. We also have in here our security information, our security contact, if you need to have your password reset and whatnot. It's all in this user guide. Okay. We have the CMS contacts here, the CMS site, CMS contacts, the CMS EHR program overview. You can also click on our communications. These are our past newsletters. And here's okay, here we go. And we're on, this is our white papers, and this is for those that need to do AIU, adopting or implementing or upgrading. But at this point, again, you should already have done that. You shouldn't have to go back to CMS unless it's to update information. Right now, you're just coming in for meaningful use. But these are white papers that will, here we go, go over patient volume, depending on your entity type. Talks about group practice. We get a lot of questions on group practices and group proxies, so you're going to find information on that site. Okay, we're going to go back here. We're going to go ahead and access Provider 1. You can also on this page here, if you've forgotten your password, you can try where it says right here, click here. You can click here, and sometimes there'll be a hint. And if you do the hint, if you're the one that set up the password, then you should be able to reset your password. We're going to be on the welcome page here, and you should have the EHR administrator profile. If you do not have the EHR administrator profile, you're going to need to contact our security department, or you can contact your system administrator, and they can add that profile for you. And I click Go. This is the provider portal page. Because your only profile should be EHR Administrator, you will not be able to access any of these links. If you try to click on any of these hyperlinks, it's going to give you no access. You're going to come to the top right-hand corner and click on the EHR Incentive Payment Program. Second here. And on this page, you have your start and your track button. The track button is just going to let you view things. It's not going to let you edit anything. You can go and you can click on it, enter your registration number. The registration number you should have received from CMS. If you don't remember your registration number and you are the contact person, you can get a hold of us and we can help you out with that. See how it's highlighted up your track? We have a lot of providers that will call or send us in a Smarter Track ticket saying that they're in and it's not letting them input any information. And we ask them to send us a screenshot. Almost always they're in track. It's highlighted right here. So if you're in track, again, you can't add or edit any information. This is just to see where you're at in the registration process. And over here, it says right now the registration's in process. Otherwise, it'll say if you've already submitted state review or state approval, payment has been processed. You can also, in this, when you're in track, the only thing you can do is upload documents. I'm going to go back home. We're going to start. Start is where you're going to go ahead and start your attestation. Enter your registration number. See how register here is highlighted. And you can see over here, we received your registration from CMS, and it's time to continue with state registration. Your registration number, your NPI, your username, and you're going to land on the Federal Information tab. And you can see that we're on payment year 3. So this is going to be meaningful use, stage 1, year 2. We'll click on the icon. Gives us all your information. Here is the email contact information. This is where you want to make sure that it's you. And if it's not, again, you need to go back to CMS and update it, and it'll interface over and update it in our system. Next tab is the Eligibility tab. Here you can see the EHR status. Year 1 is adopt. We did year 2 meaningful use. We're on year 3. Program year 2013. Here's your certification number. Click on payment year 3. We're going to go ahead and fill in the fields. And as we're doing this, if you have any questions, we have what's called Tooltips. You can go ahead and hover over any of the question marks here, and it's just some help on what we're asking for and what we're needing. I'm going to go ahead and do prior calendar year. And we're still, it should be for 2013, so prior calendar year, eligibility dates always, your encounter information. It'll auto-populate the end date. You're going to use your toggle buttons to fill out the patient volume information. And it's a new feature that seems to be causing some some confusion for this. It was released at the end of December, and you guys will notice it is include organization encounters. When you click yes now, this is different from last year when you did if you attested for meaningful use stage 1, year 1. This year we'll have all of the organizations that this provider is associated with, which means this provider is listed underneath these groups, organizations, in Provider 1. If you don't see the group that you want to choose, your system administrator can go in and add the servicing provider underneath the organization, or you can call it provider enrollment, and their information is in the user guide we looked over later. We'll revisit that at the end. I just wanted to show you, if you choose a group, this is what you're going to see. You're the first provider to submit the eligibility details within the group. once you save your eligibility information, only you will be able to edit the group eligibility details. So if you go in and say there's 5 people in your group, and you go in and you register 3 in April, and you go back in November and you try to register the other 2, and you put in different date and you choose that group, it's going to auto-populate the very first person you registered in there. It's going to auto-populate with their information. We're going to select no. No cost encounter. Let's see here. Enter your encounter information. If you select yes, you have to put a number in the no-cost encounters. This isn't mandatory. You don't have to include no-cost encounters. We're going to do 20. And we're going to say yes. We're going to go ahead and do Oregon. Okay, we're going to just go ahead and pause for a minute. Looks like we have some people that maybe have joined a little bit late. For those of you that just joined, we are within the eMIPP application, and we're walking through, this is a test provider, so we're walking through attesting to meaningful use, stage 1, year 2. So we're just going to pause, and we'll come back and we'll continue on. All right. We're back. I noticed we're getting a lot of questions on the organization, so we're going to go ahead and just cover that one more time here. So it's new functionality for 2014 if you're coming into a test for meaningful use. It doesn't, meaningful use stage 1, it could be year 1 or year 2 regardless. The new functionality is if you now choose include organization encounters, there's going to be a drop-down, and there's all the organizations that the servicing provider that you're currently attesting for is associated to. So they're listed. If you went into this, say you went into HealthPoint Federal Way Dental and you're in Provider 1, this servicing provider would be listed underneath that organization. If, when you click the drop-down, and the organization that you want to include isn't listed, you need to have that servicing provider listed underneath the organization in Provider 1. And you can do that by having your system administrator going in and adding the provider, or you can call provider enrollment and they can have that done for you. And at the end, we'll cover the contact information for provider enrollment. Let's go ahead and click HealthPoint Federal. Here's your EHR status in the bottom. It's going to say you're attesting for meaningful use. Here's your EHR certification number. This will only be populated if you entered the certification number at CMS. If this is blank, you're going to be required to enter your EHR certification number. Again, here's your contact information. Let's hit Save. Oh, we're going to go back. Click no on this. Next tab is going to be your Meaningful Use tab. Here's your information from the previous year. These are the start and end dates you used. So your Meaningful Use dates should be in the current year that you are attesting for. So 2013, your Meaningful Use dates will be in 2013. We're going to click on that. Again, the end date's going to auto-populate. This is where you're going to choose if you want to manually enter your information online or if you want to do a PDF. We're going to go ahead and select online right now, and we'll show you. Here's your tabs across the top. The summary when you're done. When you're done, it'll show your numerator, denominator, if you have an exclusion. We're going to go to the course set. Here's the different objectives. Let me click on one. It's pretty self-explanatory. You can toggle if the exclusion applies to you. Here's an explanation of the objective, the measure, if the exclusion again applies, your compliance. And up at the top here, this is Meaningful Use for core measures. You have to fill out all 13 of them. Once you open it, you can toggle to open and close. You don't have to click Save. You can just continue to scroll down and fill out each one of these. You can just continue until you're complete, and then you can go ahead and click the Save button. It's the same thing for the menu set. Again, for menu, EPs must fill out 5 out of the 10. We get a lot of questions on this. Make sure at least one of them is the public health measure, which is going to have the asterisk next to it. Here's the clinical core quality set. It explains exactly what you need to have filled out here to be and here's the menu set. Again, you can open it. It's going to explain it. Scroll down, and then click Save. We're going to hit Cancel. Going to go back to the Meaningful Use tab. Click on our Year 3 icon. We're going to choose PDF. You can upload the template. So these templates, depending on what year you're attesting to, 2013, 2014, they are out on our website. We'll go back and visit it again at the end. You can go ahead and upload those at any time, save them to your desktop. That way you have it. You don't have to go into the Meaningful Use application to get it, and you can get those done ahead of time. If you have a large provider group, that's probably the easiest way to do it. So you can toggle your way through the PDF form, save it, and then when you upload it, you're going to go browse for it, upload it, and then you're going to click Save. It's going to let you know that it uploaded successfully. I'm going to go back to the Meaningful Use tab, click on your Year 3 icon. We're going to go to the Summary page, and there's all your information that you just uploaded. And down here on the MU overview, it'll tell you that your checklist, that you've completed all three, your core, your menu, and your CQM measures. Here's the Upload Document tab. This is the tab you can go to, and you're going to upload any supporting documentation that either one of our eligibility coordinators might ask you for. It might be a current ONC certification, something, your EHR contract. And probably starting in maybe a month from now, we're finalizing the our supplemental documentation form. What we're going to be asking for, it's going to be it's sent in a link to you. When you receive the email that I showed you earlier, there's going to be a link to SurveyMonkey, and within that link, you're going to be filling out some supporting documentation questionnaires, and we're also going to ask you to upload things, samples of tests, of patient lists, depending on what you attested to for your meaningful use, but we're going to ask for that documentation, and this is where we're going to ask you to go and upload that documentation. And we're also going to ask you to upload, this is a screenshot of the survey, the very last page of the survey. So before you click the Done button on the survey, you're going to print this out, this prepayment supporting documentation for meaningful use. This is stage 2, but we have stage 1 out there as well. And this will walk you through on how to print this out and how to upload this page in the eMIPP application. And this will be required. The supplemental documentation will be required at the time of attestation. So the link of it will be in the email that's telling you you can come back in and attest for meaningful use, but it will be required. And this is how you're going to go to the Upload Document tab. You're going to click your Browse button, pick your file type. So here's, put your description in. Okay, we're on the Attestation tab. You're going to click Accept the Terms and Conditions. You can print out this attestation as well. I would print it out and keep it for your records. And you're going to get, if your meaningful use information isn't complete, you're going to get an error. Let's go back. If anything isn't complete or done, it's not going to let you attest. It'll tell you exactly what it is that you need to finish. And I'll try it again. No. What isn't complete? Let's see. Okay, see if it works this time. It'll ask you if you want to submit it, and once you submit it, you cannot go back in and edit any information. At that point, it's sent off to our eligibility coordinators. So they'll review it. If there's anything missing, they'll contact you. The contact information is in there. If it ends up being rejected, all that is, it's rejected, so you can go, then at that time you can go back in, you can access it and update any information that needs to be done. So, okay. And that's it. And at that point, you can click your Attestation Summary. So your payment year, print this out for your record. This is new for 2014 as well. So if you try to go back to start, say, oh, I put in the wrong encounter data. So you go back to start. It won't let you go back in. You're going to have to contact one of our eligibility workers. You have to go back into Track. Track is the only way you can go in, and that's just to review your status, where your application is at, and or to upload a document. Again, you can see Track is highlighted, and you can see it's in state review. So I know we get a lot of questions sometimes asking, where is my application at in the process? This might be quicker for you than waiting for a response from us, although I know that both of the coordinators are quick to respond to most of the inquiries that we get. This is another way you can do it without submitting a ticket. Okay, we're being asked to go back and visit the SurveyMonkey. So let's go in. Here is the email that you're going to be receiving when it's time to go ahead and come back in. The Washington Medicaid Electronic Health Records Incentive Program is now accepting applications to attest for adopting, implementing, or upgrading, as well as attesting to meaningful use. It'll tell you what you need. You need your registration ID, where you can go, click on back at CMS if you need to update any contact information or anything. Maybe you need to update the payee 10, payee NPI. Then we'll show you how to do that here in just a minute. Here's our contact information if you have any questions. Here's the security. And this is all in the user guide as well. All of these links, all this contact information. But we're also going to have a link in here to SurveyMonkey. And when you click on that, it's going to take you to, depending on what stage you're in, stage 1 or stage 2, the supplemental documentation. And again, it is required. Let me show you an example again of that. This is the last page of one. So this is just an example of one for stage 2. Please list the 5 clinical decision support interventions that were implemented in addition to drug, and drug allergy interaction checks. So you would fill this out. There's 2 pages. I believe there's somewhere between 6 and 9 questions per survey, depending on stage 1 or stage 2. Before you click Done, you're going to print this out, and you're going to go into that Upload Document tab in eMIPP, and you're going to upload this and any other documents that any of the questions might ask. It might say, provide us a copy of your test, provide us a copy of the allergy list, whatever it is it's asking for, and if you're attesting to that measure. So you'll print this out, upload it to the Upload Document tab. And the link for that, again, is going to be on the email that you're going to be receiving. And the person that receives it is the contact person in eMIPP. So if that person has left the office, if it's somebody that's taken over that duty, you're going to want to go to CMS, and you're going to want to change that contact information. And say you're new to the office and you've taken over this responsibility, you call us to try to ask the status of your application. If you're not listed as the contact, we can't give you any information. So it's really important that you keep that updated. We were having some problems at the beginning of last year with business relationship required for reassignment of payment. So this is a document that was created to kind of help walk you through that process, and it's out on our website. We'll go look at it again in a minute. But this is what the business relationship looks like in Provider 1. And this is very similar to choosing your org in the eligibility screen. When you're choosing your org, to make sure you have that servicing listed, there has to be that relationship. The servicing provider has to be listed underneath that org in Provider 1. And if the servicing provider wants to assign their payment to the clinic, again, they have to have that relationship. Something else I wanted to mention when you are first logging in, we're back at the application. Let's say we haven't attested yet. When you put in your registration ID, sometimes you might get an error, and in the error said that the provider's license is no longer active. You have to keep your license updated at Department of Health. Department of Health and Washington's and Healthcare Authority have an interface that runs. So when you update your license or certifications at Department of Health, it updates it in Provider 1. So if it's lapsed or it's expired, that means you're no longer an active Provider 1 provider, and you can't access the eMIPP application. So you want to make sure you keep your license and certifications updated. If you receive that error, you're going to want to go to Department of Health and make sure that's updated, and you can also contact our provider enrollment department. We're going to take another break, give the eligibility workers time to answer some questions, time for you guys to go ahead and ask some questions, and we'll turn in just a moment. Okay, we're going to go back to the website. And over here in the green bar on the left-hand side, you'll see where it's EHR. These are the tabs that you're going to want to click for EHR information. The instructions and worksheets is going to take you to the tab probably with the most information and probably where we get the most questions, inquiries from providers. This is where we send them, is to the instructions and worksheets, and it's at our website, healthit.wa.gov, instructions and worksheets, and we're under eligible providers. If we have providers on today that have yet to attest for AIU, we have information, EP, AIU, eMIPP user guide. And this will walk you through attesting your first year for AIU. It gives you the link to provider 1. It tells you what you're going to need. You need to have registered at CMS already. For each provider that you want to attest to in eMIPP, you have to have a registration number. You're going to have them registered at CMS. If you're AIU and you've listed yourself as the contact person at CMS, once the state receives the CMS information, you're going to get this email that I showed you earlier. And again, the contact person is going to get the email, and you're also going to get an email that's going to have your login credentials on there, your security credentials. So it'll have your username and your password. Once you log into provider 1, it's going to ask you to reset your password as well. It's just going to be a generic password when you first get it. And this user guide is going to walk you through it, again, step by step. Hit the drop-down what to choose, your profile, or at the provider portal page. Again, you won't be able to click on any of the hyperlinks. You're only going to be able to access the links drop-down in the upper right-hand corner to access the incentive payment program. It's going to walk you through each one of the tabs. You see you're not going to have the meaningful use tab because you're an AIU. You should only have one icon up here. This is the federal information tab. Your email address, your contact email, double check it. Look at your payee NPI. Again, you can see up here where it's highlighted, register is highlighted. If it's not letting you put any information in the eligibility tab, look and see if you're in track. You can only edit information from the start button. If you're in track, it's not going to let you change anything. And it looks just like the eligibility tab looks just similar to the meaningful use attestation. Same thing. Only here you're going to say it's going to be adopt, implement, or upgrade. This one doesn't have the certification number, which means it wasn't entered at CMS. We've been told that it's not required at CMS, so if you don't enter it, you're going to have to enter it in our application. Otherwise, it'll be auto-populated if you entered one at CMS. This will walk you through the reporting period, the patient volume. Uploading the documents. It's the same thing we walked through just a little bit ago. testing, printing out your attestation tab form. This is a view of the attestation document when it's printed out. And then at the end of all of the user guides, it's going to take you to a glossary, what type of AIU documentation we require. If you can get this stuff uploaded into the application before submitting your application, it's going to make the process go that much quicker. Make sure you get your payment quicker. So I would read through that, see what we're needing. It explains, again, charity care, F2HC, the needy patient volume, no cost encounters. And just so everybody out there is aware now, no cost encounters or encounters that weren't paid, denied, or we can include those now. We can include non-covered services as long as it's an eligible client that you're seeing. We don't have to pay for that encounter anymore. It doesn't have to be a covered service. You can still include that. Here's a link for the ONC number or the ONC certification site right here. So here you can click on this and you can get a list of all the certified EHR systems. And it has the 2014 cert list out there now. Definition of a PA-led clinic. We get asked that question a lot. Definition of a pediatrician. The practicing predominantly, we get asked that a lot. When to apply for the next payment year. And here's some of the contact information. So if you're having log-on issues, we get calls and tickets a lot saying I never received my login ID, never received my password. I don't know my login ID. I don't know my password. Provider One Security at hca.wa.gov. That you're going to want to contact. Error codes in eMIPP. If you're getting an odd error code or there's no response, the screen looks odd. If you're familiar with the screens and you're in this year and the screens look odd, it could do with compatibility mode. And in the user guide, it tells you where to go to how to fix your compatibility mode because eMIPP is not compatible with IE10. That's something that they're currently working on. Hopefully we'll have a fix for. But in the meantime, this is how to fix that. So if you're in there and you click Start and it's just spinning and not doing anything, the system's just sitting there, it's most likely that you're not in compatibility mode. We talked about the track versus start. Make sure you push the Start button. This was a question we received a lot of, so we put it in here. The tax liability goes to the payee NPI. It cannot be changed once payment has been issued. So that's why we created that paper, how to get paid, getting paid correctly. This one, that's out on our website. I'll show you where in just a moment. Here we have our provider enrollment services. Here's their phone number and extension and their email. If, when you're in the organization drop-down list and you don't see when you're in the eligibility tab and you want to include organization encounters and you click on the toggle button and in the drop-down list you don't see the org that you're looking for, this is who you want to contact to have the servicing provider added underneath the org. And then these are the CMS contacts. That's our AIU user guide. Which is underneath, which is instructions and worksheets under eligible providers. We have the MU user guide underneath it. We also have the PDFs the uploadable PDFs for meaningful use on our website, so you can just download that onto your PC or wherever you want to keep it. So if you have 30 providers you have to fill these PDFs out for, you have it there. We have Stage 1 and Stage 2. And these also tell you how many you have to fill out for core, for menu. Here down lower we have your 2013 PDFs. So for those of you that are going to be coming in prior to our cutoff date, February 28th, and you're doing meaningful use for 2013, these are the PDFs you want to use. They're inside the eMIPP application when you go in, but if you want to, again, you have a large group and you want to fill them out prior, you can go to our website. Here's the business relationship required for payment. Kind of walks you through how-to document that I showed you earlier. If there's any information that you guys that you see that's missing from this website that you might think is helpful, please let us know. Under our white papers, there's the white paper 1, patient volume calculations, and I believe this one talks about, yep, we have the CHIP information we get questions about, and group practice information. This is our group proxy. That's white paper number 1. We had a lot of questions on the group practice. What is a group? It's not a group. You have to use everybody in the group. Talks about border areas. All your documentation you want to keep for audit purposes. And again, that's on our website, the green bar to the left under white papers. And that was EP patient volume. It's a great toolkit that CMS put out. It'll open for me. It's a Stage 2 toolkit, so it's out on our website as well. You might want to go and review this if you're going to be testing to Stage 2 soon. It gives you all the 2014 CQMs. The tip sheet, it doesn't just pertain, it's not just Medicare information, it's Medicaid as well. It gives you the Stage 2 timeline. So that's out there under white papers, eligible providers, MU Stage 2 toolkit. Our appeals process is listed on there. Supporting documentation for audits. We've had this has popped up lately. We've been receiving some questions on this. We're working on having this updated right now. Excuse me. Communications. Again, these are our newsletters. If you're not already registered on our listserv, please do so. On the bottom here, you can click on this. You can sign up for it. Something pops up from CMS or something we just learned. We send it out usually our listserv. Our newsletter only goes out once a month. So although if you're getting our newsletter, you'll get the information eventually, if you're signed up for the listserv, you're going to get it a lot quicker. Let's see. This just takes you to the CMS site. CMS contacts. Here's the attestation calculator if no one's seen this yet. This was put out by CMS, and I believe we sent this. This was in our newsletter, and we also sent this out via listserv as well. It walks you through it. And this is being, again, this is being recorded, and it'll be out on our website, so you can go back and you can refer to it. And I think, I know this was scheduled for 3 hours. I think we were planning on a longer question and answer time, but I think the girls have been managing to pretty much respond to everybody as we've been going along. We're going to go ahead and take another pause and read through some of the questions and see if there's anything else I can cover for you. 1 second. Okay, looks like we're still getting questions on the Meaningful Use Supplemental Questionnaire. So I just want to let everybody know that it's not in effect right now, and if you've already attested, you don't have to go back and fill anything out or send us any information unless it's just already known required documentation that the eligibility coordinators will be asking for. You do not have to go back and fill out this questionnaire. It's for anybody that's going to be attesting in 2014, and it's not even going to be released probably for 2 more weeks. So it's nothing anybody has to do right now. I just kind of wanted to give everybody a heads up because we will be implementing that hopefully within the next 2 weeks. And again, you're going to see that link for it on the email. And it'll be available on the website. Yes, thank you. So I think that's it. I know that there's quite a few questions that we're going to have to get back to people that they're flying into the girls here. So they will be answering these probably over the next couple of weeks and getting back to people. If you have, and this is my very first webinar, so sorry if it was. Thank you for your patience. Sorry if it was clunky. Any suggestions? Please go ahead and put it in the. Submit your questions to the girls. Any suggestions would be great. If you found this helpful at all. If we need one for AIU, I honestly didn't think we needed one for AIU. That's why I started with the Meaningful Use Stage 1. We are already going to be preparing one for Stage 2. Hopefully that one we'll be doing within the next couple of weeks. And as I said earlier, it's not going to take the full 3 hours. So I want to thank everybody, again, for your patience. I'll pause a few more minutes to see if there's any other questions, anything I can help with before we log off. Okay. So someone was asking if we're going to, with all the questions and the answers that we're replying back to, if that's going to be posted somewhere, and we will put those together, and the webinar, and an FAQ, and it's all going to go out on the website at healthit.wa.gov, which is up on the screen right now. Okay, everybody. Well, thank you, and have a good day.